At that Senate confirmation hearing today, Health Secretary nominee Robert F. Kennedy Jr. testified he is not anti-vaccine but pro-safety. Kennedy denied he wants to dismantle Medicaid, but struggled to explain how he would reform the program that provides health care for nearly 80 million people.
We are joined now by our chief medical correspondent, Dr. Jon LaPook. John, start our conversation off by telling us what RFK Jr. would oversee. Massive department.
Yeah, you're right, John. You know, HHS is huge. We've put together something I want to show you. The annual budget is $1.8 trillion. That is 26 cents out of every dollar that the government spends every year. And it oversees 13 federal agencies, including the CDC, the FDA, Medicaid, Medicare, and the NIH, which oversees a tremendous amount of medical research. So this organization really affects almost all of us.
Massive, but what would be his powers as he oversees all these agencies?
You know, tremendous. I'll give you an example. The CDC has an advisory committee that recommends to the CDC what vaccines to give and when to give them. Well, the HHS secretary appoints the voting members of that advisory committee. So even without official changes, the views of somebody at the top of such a powerful organization can affect public opinion. So if there's doubts, for example, about vaccines, that can trickle down and perhaps increase vaccine hesitancy.
What do your colleagues, what do other doctors make of RFK Jr. and if he got this job?
You know, there's agreement and even excitement about the idea of making America healthier, decreasing obesity and improving our diets. Where the concern comes in is there's belief and there's evidence. And when belief doesn't square with evidence, you either change the belief, that's science, or you change or you cherry pick the evidence. And there's concern among my colleagues about holding on to belief in the face of contradictory evidence.
How concerning is it that people believe these things nowadays? There was once when this was believed to be settled fact, right? Science, fact.
In the 1950s, the high watermark, you know, when polio for vaccine agreement and for faith in government, vaccines were given for polio, like 2 million people got it at a time when people were so terrified about what these infections can do. But now people don't even remember what measles, mumps, rubella, most people haven't seen it. Diphtheria, whooping cough. That's one of the problems. When public health is working, nothing happens. And so people don't appreciate it.
Okay, well, Dr. Jon LaPook, we appreciate you. Thank you. Appreciate it.